Alright guys, I'm going to give you a rundown of the last 10 days of coronavirus pandemic versus Adelaide, South Australia. But there's one rule: I don't care if you watch his video first or after this one, you just have to watch it if you watch this video.
States are closing their borders to South Australia as the country's most concerning outbreak in months grows. There are now 17 people infected in an Adelaide cluster. WA acted swiftly, imposing new quarantine rules on South Australian travellers. And as we go to air, 2 other states have just announced they're following suit. For more, let's go live to Elise Baker in Adelaide. Good morning, Elise. Health authorities are facing a tough battle to get on top of this outbreak.
They certainly are, Anne, and this is one way they are trying to get on top of it. This pop-up clinic was set up here at Parafield earlier this morning, and already hundreds and hundreds of people have lined up to be swabbed. Authorities interstate are also doing their bit to try and make sure the outbreak doesn't spread there. The Northern Territory and Tasmania have followed West Australia's lead by imposing a 2-week quarantine rule for all travellers entering from South Australia. Where I am right now is just 10 minutes away from where the first case in this cluster was identified. That was a woman in her 80s who tested positive to coronavirus. 90 staff at that hospital, the Lama McEwen Hospital, have now gone into quarantine. It's believed this woman got the virus from her daughter, who works in a Medi hotel in the city. Both she and her partner have also tested positive for coronavirus. This cluster has now blown out to 17 cases. 15 of those are family members, and Anne, we're bracing ourselves for even more.
Thanks for updating us, Elise.
The next day.
Good evening. South Australia's COVID outbreak has tonight grown with 5 new cases and more than a dozen suspected infections.
4,000 close contacts are tonight in isolation. Authorities say the threat is far from over, but they are hopeful they can prevent a devastating second wave. Rory McLaren begins our coverage.
Taking no chances, paramedics move a resident from Anglicare's Brompton aged care home to hospital. It comes after another worker at the site tested positive to COVID-19. While at Jepps Cross, hundreds of children were sent home from Roma Mitchell Secondary College with confirmation a student had the disease.
We are not out of the woods yet. We are just at the beginning stages of dealing with this particular very nasty cluster in Parafield.
There were 5 new positive tests today. 4 confirmed as part of the Parafield cluster, and 1 is under investigation tonight.
And importantly for South Australians, all of these people have either no symptoms or they are very mildly symptomatic, and they've been picked up early in the course of the disease.
The northern suburbs outbreak now linked to 20 cases, but a further 14 people are suspected of having COVID. 4,000 people are now in isolation.
We are prioritising our resources to make sure we visit those people who are of greatest risk to South Australia, and it is important that they isolate within their own homes. They can't simply participate in normal family activities whilst they are quarantining. They must segregate from the rest of the house as much as possible, otherwise the whole purpose is pointless.
No residents at the Brompton aged care home have tested positive yet, but a total of 3 staff members are now infected.
This is the worst nightmare any aged care proprietor can face. The residents are holding up well.
Authorities also increasingly concerned about the Aquadome at Elizabeth. Anyone who was there on November 14 between 11 and 1 p.m. told to immediately self-quarantine. SA Health adding more locations to its watch list, including a medical centre at Eastwood, a supermarket at Carolta Park and a fabric store at Jepps Cross. 36 places of concern now identified.
We are going to get through this, but we're going to get through it with the cooperation of every single South Australian citizen.
South Australians responding in their droves to the plea to get tested to get on top of our COVID outbreak. Restrictions also kicking back in at midnight. The question, how long they'll be kept in place for.
We simply don't know exactly what we're dealing with at the moment. We are doing a huge amount of work to identify any possible infections.
Every single one of us need to start thinking about, do we need to go out? Do we need to do that activity?
The hotel quarantine site in the city that sparked the outbreak is being emptied. Anyone who was there told they'll likely face another 14 days in quarantine.
We actually felt like we've been treated like criminals last night, to be honest. 6 days of my quarantine just being thrown in the bin.
I absolutely sympathise and understand your frustration, but in terms of our public safety, not just for South Australia but the whole of Australia, I urge you to be patient.
Some guests have told 9 News that they might not be moved tonight. Closing the hotel allows authorities to do a deep clean. People who are having an extended stay won't be charged for that additional time, while SA Health is already looking at using the hotel again in the future for quarantine purposes. Kate?
Rory, thank you.
Next morning.
Today, I'm asking you to rise to the challenge again. As of midnight tonight, we need our community to pause for 6 days. We are going hard and we are going early. Time is of the essence and we must act swiftly and decisively. We need a circuit breaker to stay ahead of this.
Things that are being closed or shut down effective midnight tonight are all schools except for children of essential workers and vulnerable children. Takeaway food will be shut. Universities will be closed. Pubs, cafes, coffee shops and food courts will be closed. Elective surgery, except for urgent operations and cancer treatment, will be closed. We are closing open inspections and auctions for real estate. We're also closing all outdoor sport or physical activity. FIFO workers will be on standstill for 6 days. Regional travel is not approved. If you are in a location at the commencement of these restrictions, you'll be required to stay there. Aged care and disability residential care will be in lockdown. Factories other than food and medical products will be closed, except for where it is necessary for them to remain open to prevent damage to machinery. The construction industry will be closed for 6 days. Holiday homes will not be available for lease or rental. Weddings and funerals will be banned for 6 days. Outdoor sport is not permitted. Masks will be required in all areas outside the home.
Meanwhile,
yes, the borders are completely open, but if you can delay it for a few days, unless you have to go there, please do so. But of course, essential travel is still allowed and the borders are completely open.
the next morning.
Well, the police commissioner has fired back at criticism workers at Medi Hotel should only have one job after it was revealed a security guard spread the virus at his second job. Grant Stevens says it's unreasonable to stop any worker from having multiple employers or being part of the community.
Copping criticism over the Medi Hotel's outbreak, the police commissioner came out firing.
Your expectation is unreasonable. These people are part of our community and we require them to do a really important job.
Grant Stevens taking aim at a journalist from The Advertiser.
Before you ask your question, let me give you my perspective.
Our top cop bristling when asked why Medi Hotel workers can have other jobs.
So do you think it's unreasonable then for people to question whether or not security guards are then free to go and work in other places, such as food handling?
Does it make any difference if a person who works in a Medi Hotel has a second job or goes to a gym, sits in a cinema, participates in sport, they have mortgages to pay, they have other bills to pay? Give these people a break.
The fiery exchange sparked following revelations a security guard at the Peppers Hotel was working part-time at a Woodville pizza bar while infected, spreading the virus to a delivery driver and another Medi Hotel worker. Urgent contact tracing now underway to determine who else is at risk. A risk police say will remain.
If we ask these people, including police and nurses, to go into quarantine when they're not at work, we will not have people doing this job.
But whether South Australia continues to allow Medi Hotel workers to have multiple jobs remains to be seen. Soon, Victoria won't. The government there will enforce a one-job, one-worker policy following its own hotel quarantine bungle.
Everybody who works in this program will either work for the Victorian government or be exclusively contracted for this purpose and this purpose only.
Our state has made some changes already. Medi Hotel workers must now be tested weekly, while international travellers have been banned until November 30. The system designed to keep COVID contained, defended by those in charge.
We have no evidence to suggest that anything that has happened in our hotel quarantine hasn't met the standard.
And the results of our 9 News Adelaide Facebook poll asking, do you have confidence in our state's Medi-Hotel system are in? 69% said no, they don't have any confidence, while 31%, less than a third, said yes, they do. Brenton?
All right, Tom, thank you.
Day 2.
To say that I am fuming about the actions of this individual is an absolute understatement. The selfish actions of this individual have put our whole state in a very difficult situation.
The lie was the person claimed that they'd purchased a pizza from the pizza shop, where in fact they were working there and had been working there for several shifts. That clearly changes the circumstances, and had this person been truthful to the contact tracing teams, we would not have gone into a 6-day lockdown.
12 o'clock midnight.
As midnight struck, some couldn't wait a moment longer for a taste of freedom.
This lineup is probably the worst thing I've ever seen. It really shows a lot about our population.
But most waited until this morning to return to their normal Sunday rituals.
It was such an amazing surprise that we could come back so quickly, and so grateful.
Health officials are also grateful to the public for their part in helping to stop a potential second wave.
Whenever we have asked people, could you possibly do this? Could you do this for us? They have just done it, not just 100%, they've done it 150%.
From nearly 17,000 tests yesterday, no new cases have been identified in the Adelaide cluster. Health modelling had shown there was a chance cases could have risen above 200 a day if a lockdown wasn't imposed.
We have avoided a catastrophic situation in our state by following the unequivocal health advice.
But it's come at a cost. Thousands of businesses have been affected, and many workers stood down won't get paid. There's also unease about the way hotel quarantine is managed.
We can't afford another repeat of a Medi-Hotel failure that results in a statewide lockdown.
The state opposition wants the system suspended completely until it can be moved away from populated centres.
The practice of employing subcontracted security, casualised labour in Medi-Hotels only exacerbates the risk.
It makes no sense whatsoever. We don't have 1,200 rooms in Woomera on Christmas Island to pop up with a quarantine hotel, let alone the staff.
Authorities are instead focusing on why a pizza shop worker lied about how he caught COVID.
The next day.
Children in South Australia will head back to school today after the state emerged yesterday from a short-lived lockdown. Businesses were buzzing after the state government lifted the planned 6-day lockdown early after the threat of widespread community transmission eased. Premier Stephen Marshall backed his decision to move quickly to contain the outbreak, saying the alternative could have been catastrophic. Health officials say it's too early to completely relax. They're reminding anyone with COVID symptoms to get tested.
The very next evening.
Good evening. An urgent investigation's been launched into the latest twist in the Parafield COVID cluster. It again brings into serious question the security at Pepper's Medi Hotel. Mike Smithson joins us live from a hastily convened media conference with our Chief Health Officer. Mike?
Yes, Jane, Professor Spurrier was going to join us live tonight, but this has put a major spanner in the works. Now, this is what we know. A man and a woman, in fact, they were husband and wife, returned from overseas 13 days ago. They tested positive and it was thought that they'd brought the virus in with them. Now, unbelievably, it's emerged they caught the virus right here in the hotel.
The next morning.
A dedicated coronavirus quarantine facility will be set up in South Australia to take on positive COVID-19 cases from hotel quarantine. It comes after a couple in isolation at an Adelaide hotel tested positive to the virus. Health authorities are now retesting staff and other guests to trace the source of the infection. The state's Premier has this morning ruled out wrongdoing as the cause of the initial outbreak.
There has been no deliberate breach of protocol and no evidence of people being in the wrong place at the wrong time. This is very pleasing.
There are no new COVID cases in South Australia today.
The next day.
But a new positive coronavirus case in an Adelaide school has sparked urgent health and isolation warnings. 10 News First, Cam Inglis joins us now from Woodville High School. Cam, what are health officials saying about this positive test?
Well, Norelda, they're very concerned about this latest case. A female student at the Woodville High School. Authorities believe that she attended class on Monday while infectious. Now, health authorities at the moment are desperately trying to figure out how on earth this student has contracted the virus. They are already looking at possible links to the Woodville Pizza Bar, but they have issued an urgent health alert instructing anybody who attended the school on Monday, the 23rd of November, to immediately self-isolate with all members of their household. Now, authorities are looking at whether or not public transport is in play here, whether the student caught the bus or the school to class on Monday. Now, they're looking into that and trying to determine that this morning. But at this stage, the school is very quiet. It's been closed this morning for a deep clean, while students, about 900 students normally attend class here, but it's very quiet this morning. At this stage, South Australian authorities haven't imposed any restrictions, but that may only be a matter of time.
Okay, thanks, Cam.